So let's talk about private health insurance. And I find that one of the easiest ways to understand it is to go ahead and take a little bit of a historical view. So let's go back almost 100 years to sometime before the 1920s. And before the 1920s, there was a group of doctors that got together and they started to say, well, look, we want people to be able to get to us when they need care. And so what we're going to do is we're going to go ahead and offer essentially like a membership model. So we'll have possible patients out there, and they can go ahead and send us a small regular subscription fee. So they'll send us money, and then for that small fee, they'll essentially have a subscription, almost like a health club membership or something along those lines, where if they need our services, they'll be able to get it when they need it. This is one of the earlier attempts of what's called risk pooling between people to make sure that they were protected against a larger expense of needing to see the doctor at some point. Then in the 1930s, there was an interesting twist. So there were, again, a group of workers. In fact, there were teachers that were working outside Dallas, Texas. And their school, on their behalf, said, look, we really like our workers. We want to take good care of our teachers. So I'm just going to draw a school building here, a little tower there, maybe a clock. And that school said, we are going to negotiate on the behalf of our teachers. So we already pay our teachers some wages, but what we want to do is to offer them this new benefit. So our school system is going to go ahead and also pay this center, actually near Baylor, near Dallas, Texas, and we are going to, in addition to offering them wages and salary, also going to buy them health insurance. That was actually, at the time, it was roughly about $6 or so that they paid, which got their teachers the right to about 20 days in the hospital if they needed it. This is probably one of the earliest examples of what is today called employer sponsored insurance, or ESI, which is really become the dominant way that many people in the United States get their health insurance. And in fact, this system of getting a group of workers together through their employer later became the basis of what is today known as Blue Cross and Blue Shield. However, that still doesn't really help us understand, well, that was an interesting idea that those employers, that school was getting insurance for their teachers, but how is it that that's how most Americans get their health insurance now? So to understand that, we have to go to the 1940s. And as you're probably aware, the 1940s is when the United States was embroiled in World War II. And because of that huge war effort, that was a time of rationing. There was not really widespread access to all the goods and services that people wanted. And one of the things the government did at that time was they had instituted a very tight system of wage controls. In other words, if you were a business owner, you could not really offer or increase the amount of wages you paid to your workers. And this was sort of a way to control the economy by the federal government. This put the employers in a little bit of a bind. If you really wanted good workers, you wanted better workers, you weren't allowed to really offer more money, so how would you get it? So what they did was they started to offer fringe benefits. So yeah, you couldn't offer more money, but hey, maybe we can offer workers other goodies that they might want. And in fact, it turned out the biggest goodie of all, you guessed it, was health insurance. So what happened in the 1940s was that employers started to compete for better employees based on these benefits and based on the quality and the quantity of health insurance that they offered. So this got to be a very popular way to recruit workers. But there was one other thing that happened which really kind of accelerated this trend. And that happened really pretty much in 1954. And it's unclear today whether the federal government even realized what was happening. But they made a decision. They said those fringe benefits that lead to that health insurance, tell you what, if you buy your employees health insurance, that is going to be considered a tax-free benefit for them. In other words, think about it this way. Let's say you have an employee in the old system. So you gave that employee $100 for work that they did. Well, their take-home pay is going to be less than $100 because they have to pay taxes on that. So even though they earned $100, what they're going to take home is only going to be about $80. Now let's look at sort of how this looked if you got health insurance that was tax-free. So suppose that same worker now earned $100, and because this was used to buy employer-sponsored insurance, suppose that $100, that entire $100 was value to the employee because they got $100 worth of health insurance. They didn't have to pay any tax on that. So look at that comparison. You can see that because the government said that these benefits would be tax-free, that was essentially a way for them to give workers extra money that was not taxed. It was essentially a subsidy that the federal government gave for the purchase of health insurance starting in 1954, and that continues to this day. This seriously accelerated the switch to employer-sponsored insurance. By the 1960s, almost 3/4 or 75% of American workers were getting employer-sponsored health insurance because of the way these economics are being driven. And that even to this day, the majority of Americans get their health insurance through their employer for these reasons. Let's talk a little bit now about, well, what does that private health insurance actually look like? So I'm going to spend a few minutes now describing the general structure of private insurance. Employer-sponsored insurance generally takes one of two forms. The first is called fee for service, sometimes abbreviated as FFS. And this is a type of what is called an indemnity plan. The other broad kind of private insurance is referred to as managed care. And we'll talk about what each of these kinds of health insurance are. In fee-for-service, what happens is that you may see a doctor or a healthcare provider of some type, and that healthcare provider says, okay, well, hey, we're going to do an x-ray, so that's going to cost some money. We're going to send a bill. Hey, we're going to do an operation. We're going to send a bill for that. Maybe we are doing some other tests. There's going to be a bill for that. And they generate all these bills. These bills get sent to your insurer, and your insurer then goes ahead and just pays that money out. So they send that back to the doctor for each of these bills that are sent out. And that is what's called fee for service. So pretty simple in concept, which is that, yeah, your doctor sees you, they perform a service, they send a bill, and you pay for that bill. Turns out that there's many problems with this type of arrangement. The first you can imagine is that if your insurer just pays whatever bill they get sent, think about what the healthcare system is going to do. They'll say, hey, we'll send bills that are a lot of money. Nobody's checking. They're just paying whatever we charge. So this is a setup for very high healthcare costs. So if you have a fee-for-service or indemnity system, there's a tendency for the healthcare system to start charging high prices because they know you're going to pay it back. So those premiums or the costs may go higher and higher over time. The second problem is that because you might see different doctors are all sending different bills, they're all getting paid, the type of care you get may be very fragmented. Your doctors or healthcare providers may not talk to each other. There's no incentive for them to talk to each other. And as a result, the quality of care you get may not be as good. The next thing, the third problem with fee for service is that over time, as those fees go up, you increasingly have the patients have to pay more. So in other words, cost sharing increases over time. So your premiums may go up, your employers have to pay more and more, and over time, what that does is that money comes out of your wages, and so your wages have a tendency to be even lower over time for fee-for-service because more and more of that money is going into paying for your health care. So those are the problems with the fee-for-service system, and it's actually led this to become much less popular. In fact, it's estimated that fewer than 5% of all people who have private health insurance are in pure fee-for-service type plans. Instead, there's really been the rise of what's called managed care. And managed care has a couple of important features. So what happens is that when you manage care, your insurer goes out and they actually create a group. They find a group of doctors and hospitals, and they make a contract with them. They'll say, well, hey, these are the rates that we're going to pay. If you want to get access to the patients we're going to send you, you have to agree to this payment schedule in some way. And so that serves as sort of a check on the costs that will be charged. In addition, they might say, well, we might even have disease management programs because we manage people's care. We don't want them to get sicker because the sicker they get, the more it's going to cost us. We're going to have all these programs to make sure that people get better care. If you have diabetes or asthma or heart disease, that's going to mitigate the risk or hopefully cost us less money. We're going to manage people's health a little bit more closely. Finally, what we might do is we want to keep those costs low. So if some of our doctors start to charge more money, we're going to start tiering doctors. In other words, we're going to change the co-pays. So if you go to a high-cost doctor, you may have to pay a higher deductible. If you go to a lower-cost doctor, then you might have to pay a lower deductible. So what they do is they manage what doctors you go to, and they are much more aggressive in making sure that patients seek out lower-cost doctors. As a result, what they do then is they also have very specific networks or groups of doctors which might be the preferred doctors that they want you to go to. So in this way, many insurers try and exert a little bit more control over the bills that are being sent and how much those insurance companies pay. And most people today are now in these types of managed care programs.